I am Dr. C.L. Venkat. Genital tuberculosis. It can affect the male reproductive system and also female reproductive system. This genital TB is more common in women. It affects the various parts of the uterus. It can affect this portion is called cervix. It can affect the interior of the uterus. That interior lining is called endometrium. Then it can affect the tubes, fallopian tubes. Then it can affect the ovary. This is called ovary, which will produce the eggs. So these are all the various parts wherein TB can affect. What will happen if it affects the female reproductive system? What are the implications? Once TB affects, the lady may have menstrual problems. They become very irregular. There are local symptoms arising out of uterus and there are general symptoms because of TB. The local symptoms are menstrual irregularities. It could be delayed or prolonged bleeding during periods, or it is very less. Then they may not be able to conceive and have child because of tuberculosis of the female genital tract. What are the general symptoms? General symptoms are loss of appetite, loss of weight. The temperature typically rises during the evening period. Morning fresh, evening dull. That is the hallmark of tuberculosis. They may not gain weight. They lose weight. They look weak. They get easy fatigability. All these things are general symptoms. Then it can affect the male reproductive system. In men, the testis that produces male sex hormones and the semen, spermatozoa, the testis size may increase. There may be mild pain in the testis and fluid may accumulate by the side of the testis and it may be responsible for hydrocele. There is a part called epididymis on the top of the testis like a cap that gets enlarged. So the two main parts that get involved in men is the testis and epididymis. As a result, the semen quantity may be less and the sperms may not be motile or mobile. The shape of the sperms may not be normal. How to detect genital tuberculosis? In the blood test, complete blood picture if it is done, there are more number of white cells. Amongst the white cells, the lymphocytes will be more. Then there is a test called ESR. ESR will be raised. Then X-ray chest. If it is done, there may be evidence of tuberculosis of the lungs. Then there is a skin test called MON2 test. If this test is done, they inject a small quantity of a special substance. After 72 hours, if there is swelling, if it is more than 10 millimeters of swelling, then MON2 test is positive. In addition, there is another blood test which is very sensitive to detect tuberculosis. That is called quantiferon TB gold test. For female reproductive system, by doing a D and C, removing a small portion of endometrium, sending it for biopsy. That is called endometrial biopsy or cervical biopsy may pick up tuberculosis. In men, ultrasonography of the scrotum may show evidence of swelling of the testis, swelling of the epididymis. Sometimes, if we are unable to confirm tuberculosis, biopsy, small tissue is removed from testis and epididymis to confirm tuberculosis. The overall impact of genital tuberculosis is that even though after getting married, it is responsible for infertility. When the tubes get blocked, fallopian tubes get blocked because of TB, the traveling of the sperm and the transport of the egg is prevented, thereby they will not get children. So, whenever a couple visits a gynecology obstetrician doctor, they always look for either of the couple, husband or wife, whether there is any past history of suffering from TB. Some of the people during the childhood, they suffer from TB. That childhood tuberculosis is called primary complex. So if they have suffered during childhood, then it may lead to infertility or reoccurrence of or exacerbation of tuberculosis. So you have to carefully ask the couple. If they are unable to tell, their parents of the couple, they may be able to tell, yes, during the childhood, we have administered treatment for a period of 3 to 6 months. Long-term treatment for 3 to 6 months for cough and fever during the childhood, it is more likely that they would have received anti-tuberculosis treatment. If genital tuberculosis is confirmed, if treatment is offered for a period of at least 6 months, then the genital tuberculosis will come under control. Some rare cases, one may have to use for a period of 9 months. Generally, 6 months of anti-tuberculosis treatment, the tuberculosis will get cured, and afterwards, naturally, without any operations and without any problem, they will conceive. As long as either the husband or wife are suffering from TB, genital TB, they may not be able to conceive and get pregnancy. Once it is cured, there is every possibility to conceive. If there is an inherent TB or a latent TB not coming out, sometimes the TB of the uterus may lead to miscarriages also. So, when we are evaluating the miscarriages, one of the likely reasons is uterine tuberculosis.